Welcome back to Eastern Lifestyle. I'm here with Lynn Pischke, Executive Director of the Cancer Services of Eastern Carolina, and she is here to tell us about the Mission in Motion project that they're starting right now. So Lynn, thank you for joining today.
Thank you for inviting me. I'm so happy to share this information with you. This is really important to us, and we're very excited about the possibility of where this is going to go. We are in our pilot stage where we're actually realized that there was a need for mobile cancer screenings in rural communities. We have a lot of medically deserted counties that are here in North Carolina, in Eastern North Carolina specifically, and oftentimes the residents don't have transportation, or they don't have equipment or a provider in their market that they can go to have something basic and life-saving like a 3D mammogram. So we decided to address that and started writing grants like crazy, and were able to secure funding for us to provide 232 mammograms last year to people who otherwise would not have received them.
Wow.
So that was exciting.
So Mission in Motion is, in simple terms, tell us, what is it?
It is where we have two parts to the program. We have a relationship with Envision Diagnostics, which is currently the only provider that will come east of I-95. And we take what days they have left to give us because they're very established, but they're heavily in the west side of the state, which we've learned most cancer screening vehicles are in the west side of the state and not east of 95. So we take every day that they can give us. We're doing 7 days with them this year so far, and every time they have an available day, they let me know and we fill it in one of our communities. But we kind of have to be on a waiting list because it's hard to find the equipment. Everybody wants it because it just doesn't exist here. So that kind of brought us to step two. If we can't bring the equipment to the community, can we bring the people to their nearest equipment? We are able to do 24 round-trip trips for patients in rural communities and carry them to the nearest 3D equipment so that they can get their mammograms, and pay for their mammograms with a grant that we receive to pay for mammograms. So we don't want there to be any reason that someone is not getting their annual mammogram. We want to make it really easy.
So why is it important to make sure that patients are getting their annual mammogram?
Well, 1 in 8 women will be diagnosed with breast cancer in their lifetime. In Eastern North Carolina, we have health disparities because of the lack of access to health care in rural areas, which means that by the time cancer's discovered in a patient, it's often later stage and much harder to treat. And they have a poorer prognosis. And so overall, the mortality rate is very different in rural areas than it is in urban communities. We also include an important piece to this program, and that is to have a representative of their local health department present so that they can have the opportunity to apply for Medicaid. With the Medicaid expansion, a lot more people qualify, and that means that that family is going to be connected to healthcare, which is good for everyone. But our mission has really shifted to trying to address the disparities of rural healthcare, and that is by bringing cancer screening. So we are in the process, we're about 70% there, of raising funds to purchase our own mobile mammography vehicle that will live in Eastern North Carolina, that will be exclusively for the residents of rural Eastern North Carolina. And so we're hoping that by the end of the year, we'll be able to place that order. We have a beautiful website. We just got it, so I'm very proud of it. It's cancerservicesofenc.org. And you can find all of our events, our fundraisers. You can see the donate button, how to support us if you'd like to. You can designate your gift for any cause that you want. So if you're a pediatric cancer supporter and that's what you would like to do, that's fine. Just make sure that you designate, if you have a preference, where it should go, and we'll make sure that it goes there. So it's a wonderful mission, and it's something that we really need to address.